Mine and I go. See your fair.
Amen. Red Abraham, Payonko do. Christo Mumba. Christo Mumba. Christo Mumba. Amen. Amen. And our body and I say, wo anwa kwan strong so a waboye nyina ye ho ban free me be brain no ade ya be hie mu enim se nipa no bi nso enam kwan mu ba ye me pai bo se mu nyina be ba be ka ye ho asomdwe mu. Amen. Ne ye wo ye health topic and I said jumedi a edru so no e ye health topic. Na ye nya obi a se ye nya ye ba ye nua ba ya de nyina Dr. Sarah Peprah. Amen. Now, Dr. Sarah Peprah is a gynecologist or so specializing in women's health. Nti ne wabobon ho bebre niema efa ema ye ho ya pomuden ho nsem bebre ene ne one ye beche na obeja room for more questions. Nti no ansa na ye nua ba na se Sarah ebekasa no mama ye kata ye ni na ye mo mpae. Onyameton for yeda wase nya ode abedwiri kayen se kayen fata na so wadom ne wo ho mobro ntina afrebia no ukoso ema weni kwen ho ne senti ye kase beje waye ne wona ase da samre dwumedia eji sui eye yan apomodin ho nsam ejai speaker Dr. Sarah Peprah ehye won sashon kokwanso erade betel na no manyansa manimdie no fan church samre boni wiase mu no edema ebetime de aboye ho ban na ya twe ye ho efi yarwa hodo nyina ho we ni adon bebre ni extra or be Jesus Christ ne demonti. Amen. Amen. Dr. Sarah Peprah currently no or practice New York Presbyterian Hospital in New York into no major platform so ede amano. Amen.
Amen. Happy Sabbath.
Happy day.
I want to thank the Women's Ministry Department for allowing me to stand before you today. Before I begin, I want to say that it's true. My English is sometimes a little bit like some people will say I rattle it or I speak too quickly. But I'll try to take my time. And if there's any questions that you have at the end, please feel free to speak in English or in Tree. I'll understand you, but please watch me a while. I'll speak back in English. So if that's okay, we'll begin. I want to say that just a little bit about my background. So I'm from New York. I grew up in the Bronx and in Long Island, and I went into women's health because I wanted to take care of women. Because what I realized is that we're always taking care of everybody in our household, the husband, the children, your aunts, your parents, everybody. But they don't often take care of themselves. And so what I want to leave everybody today with the message is that you as a woman are very important, because without you taking care of your own health, your family wouldn't be there. And so I want you to take this message that if you don't get anything else, please take your health very, very serious, because we know and studies have shown that if a woman takes care of her health, the whole village, the whole family structure is improved by it. So at the end of the day, you know, as you're taking care of your kids, you're taking care of your husband, you're doing all these things, don't forget about yourselves, because you two are very important. And so I realize we have only a few minutes, and I want to leave a lot of time at the end for questions. So I'm going to try to hit a lot of topics at once, just to give you a broad overview of a lot of the questions that my patients will ask me. And if you have any questions at the end, please feel free to speak. I want you to understand that this is an environment in which we can be comfortable, and there is no judgment here, because we're all learning. And so one of the things I wanted to open my talk with is that as an OBGYN, we deal with a lot of sensitive questions, but also some questions about basic things about life. And I realize that a lot of times some of us haven't been taught, or we've never experienced those things, and so sometimes we're afraid to speak up about something that to other people may be normal, but you don't know if it's normal for you. So I want you to know that here there is no judgment, here is a safe space, and you can ask and learn. And so one of the questions, or the topic I'm about to present to you, is general questions that as an OB encounter, and I want to do it from each age group. So starting with like kids, going into the teenagers, young adults, and then going into menopausal or older women ages as well. And so starting from kids, so one of the main things is that somebody will come to me like, Dr. Peprah, my daughter is 12 years old and she hasn't had her period yet. Is that normal, or what is normal bleeding? And so the average age of people getting their period, it used to be 11 or 12 years, but now, especially because of the American diet, the age has come down to like usually around like sometimes around 9 or 10, as early as 9 or 10, but usually around 10 or 11. And so if your child gets their period as early as 9, that actually can be normal. What's considered not normal is if they're getting their period around like 7 or 8. Sometimes there are people who can have hormonal imbalances, and that might be a reason why they get their period earlier. And that's something you should look into. But people can also not get their period until as late as 16 years old and still be normal. But if they're at the age of 16 and still haven't gotten their period, then that's something you should look into and talk with your doctor. A lot of times these are things that can be treated if caught early. And it doesn't mean that there's something wrong with your child right away, but sometimes you can, we can treat certain things if it's because of nutritional issues or if there's something more serious. But if you don't pay attention to the time your child starts having their period, that is something we can keep an eye on and we can intervene early on. And another thing that people ask is like, well, I got my period at 12, but it's kind of like not regular. You know, people tell you you're supposed to get your period every month, you know. But for kids, especially 11, 12, 13, when they first start their period for about a year or so, their periods are not going to be regular because their bodies are just starting to get into that hormonal cycle. So it can be normal for them to get a period and then go for months without getting another period. So if your child doesn't get their period after their first period, don't worry, don't freak out. It can be normal. That being said, moving up to the next age group with like the young adults, so I'm looking at the 20s to like 45 or 15 to 45 age group. So I always tell them your period, it should be considered another vital sign. You know how we have vital signs if you're in the health field, like your pulse, your blood pressure, all those, your weight, all those things are considered markers that can reflect your health. But I like to tell women that their period can also be a marker of their health as well. Because we know a normal period is if you get it every So you get your period anywhere from 2 to 7 days at a time. You get it every 3 weeks to every 5 weeks, that's considered normal. And you don't have bleeding in between your periods. So that's what's considered a normal period. But sometimes people can go and skip their periods, and it could be a reflection of something that's going on. A lot of times the reason why women may skip their period is because of stress. It's also because of weight gain. But there could be other reasons if your period is irregular. So certain people can have hormonal changes like their thyroid or other hormones in your body, or even if they're diabetic, that can also affect their period. So if you start to notice that your period is not normal, pay attention to it. If you're in the age group where you're married or sexually active, the first thing you should do is take a pregnancy test, because a lot of times the reason why people don't get their period is because of pregnancy. But if that's not a concern for you and you still haven't gotten your period and your period has been irregular for 3 months or more, then that would be a reason to call your doctor. But for the most part, a lot of people can skip their period here and there, and most of the time it's just because of stress. So anything you can do to reduce the stress first, that would be the first advice I would give to you after taking a pregnancy test. Another thing that's a big concern in this age group is fibroids. So, does anyone know what fibroids is? Could somebody explain what fibroids are? No? Okay, so I'll explain it in the interest of time. So a fibroid is essentially it's a thing like, hey, this is cancer, but it's not necessarily cancer. Tumor just means a growth in the body. And a lot of times fibroids are very common and they're not cancerous. In fact, fibroids are so common that they say on the order of like 30% to 70% of women have fibroids and they don't even know it. A lot of times people have fibroids and they're small and it doesn't cause issue. But for some people who have fibroids, it can cause them to have issues like their stomach can get big, bloating, they can have heavier periods, they can have a lot of pain because of it, or they can even have issues with using the bathroom. And so if you're somebody who has issues with those type of things, one of the things that you can do is to get an ultrasound, which is a sonogram, to look inside at your uterus to see if you have any fibroids. But just having fibroids in of itself is not a cause for alarm. One of the things that people get worried about is that if I have fibroids, would I be able to have children? And oftentimes, a lot of people who do have fibroids are able to get pregnant and still have children and not have complications. But it is true that there are certain kinds of fibroids, depending on their location, that can sometimes affect fertility and can increase the risk for other things like miscarriages or preterm labor. But those type of fibroids are more rare. But in general, if you're somebody who is experiencing heavier bleeding, or if you're experiencing a lot of pain, especially if it's pain with your periods, then sometimes that could be attributed to fibroids or just other uterine diseases. And the first medication that we recommend for those type of illnesses is called birth control. So there are different types of birth control pills. So birth control pills is prescribed not just for preventing pregnancy, but it can also treat things like fibroids, heavy bleeding, and period pains. And so a lot of times I have parents come to me and they tell me that your daughter's doctor started them on birth control, but I don't want them to be on birth control because that's going to give them license to go and have unprotected sex and all these stuff. But in actuality, it's not for that reason. Birth control can be prescribed in young kids because they have heavy periods or they have painful periods or even just to cycle their periods. And one of the benefits of being on birth control is that it can decrease your risk for certain cancers. I get a lot of questions from my patients that, is birth control going to cause me to have breast cancer or this or that? And the answer is no. It's not going to increase your risk for breast cancer. And it actually can help decrease your risk for certain kinds of cancers, particularly uterine or ovarian cancer. And so now, moving into the age group of 45 to like 50, so that age group, I like to call them the perimenopausal age group. But before I can say perimenopausal, I have to define what menopause is. So menopause is when a woman no longer has their period for 12 months or more. So a whole year without getting your period. Sometimes for women, that average age of menopause is 51. Some of them have it sooner, some of them have it later. And everybody's experience with menopause is different. Some people may have the what do you call this shit? Or the hot flashes? Yeah, the hot flashes. The mood swings, night sweats, or even other things like vaginal dryness. And all of these things can happen at the same time as entering to menopause or even before in the perimenopausal period. And that age range, again, is from 45 to 50, 51. So if you're somebody who is going through that, a lot of times I get my patients coming in and asking me, doctor, I want to check my hormones because I want to know if I'm in menopause or not. Well, you can know you're in menopause or not just by looking at your period. If you haven't had your period in a year, then you're in menopause. But the other thing is that when you're entering into that phase of when you're about to be menopausal, your period will change. And there's a normal change, and then there's an abnormal change. The normal change is when you have your period every 3 weeks, and your bleeding doesn't become heavier. So if your period starts to skip a month here or there, that's okay, that's normal because your body's adjusting into that menopausal phase. What's considered abnormal bleeding is if your bleeding starts to be longer than 7 days at a time, or you have your period more than every 3 weeks, like you're getting it every 2 weeks, or it starts to become heavier than it was before. If that's the case, then you should see your doctor, because a lot of times the reason for heavier bleeding or abnormal bleeding at that age is usually benign reasons, which means non-cancerous reasons, such as like fibroids or polyps or that stuff. But there's also a small group of people who have that abnormal bleeding because of cancer or abnormal cells inside the uterus. And a lot of times those type of cancers, if caught early, can be treated early. And so that's why I keep saying that the period is a vital sign, because if you pay attention to it, if you see that something is not normal and you act on it sooner, it could save your life. And then when we enter into the menopausal age group, so anywhere from around 50, 51 and on, a lot of their main concern is dealing with the symptoms of menopause, the hot flashes, the mood swings and that stuff. A lot of times with those type of things, you can treat it without medication. So things like if you have a lot of hot flashes, wearing layered clothing, and so you can take off your sweater if you start getting hot, and then if you get cold, you can put it on, or you can sleep with the fan on at night, or you can even get a fan that you plug into your phone. But there are also things you can do naturally to help treat that stuff. So if you're somebody who tends to get the night sweats and hot flashes, some people get relief by taking supplements like black cohosh or even soy products sometimes can help. But there are medications that we also prescribe that can help you with that. One of the medications that I like to prescribe is a medicine that used to be prescribed for just for depression, but it can also help with the hot flashes as well. But another category of medication is called hormone replacement therapy. And this kind of category of medications, people ask because it's like, oh, is this going to increase my risk for cancer? The long story short, it's a complicated answer, but overall, we say to use that medication, the hormone replacement, for as short a time as possible, because in some instances it can slightly increase the risk for certain type of cancers or diseases, but in the same hand, it can also decrease the risk for other cancers and other diseases as well. So you want to use that for as short a time as possible, but a lot of women do find relief with hormone replacement therapy, and it is something that's beneficial to a lot of women. And then the last thing I want to say, especially for women who are 65 and older, that you want to continue to do exercises, not just exercises that make your heart race, which is called cardiovascular exercise, but you also want to do exercise where you lift weights. Because when you lift the weights, you're building up your muscle that helps to build up your bone health and decrease the risk for you having osteoporosis, which is thinning of the bones, and decrease your risk for hip fractures, which is what a lot of older people get, and that could be very deadly to them as well. So I've said a lot, and I know we don't have that much time, but I'll leave about 10 minutes for any questions and answers. Thank you.
Amen.
Yare will be a uterus no mono. And him said birth control pills ni bebre ema onipa ye kese. And then so obia born ho ban say onko ye kese. E dan hwehwe mo na bia a doctor for timia ye say nipa say ebi a ne genes said the tie ne blood group and anaasɛ biribi say nti ebi a this type of birth control no na yɛde ma na ebi a ɛmma ne nyɛ kɛseɛ anaa saa nhwehwɛmu no wɔ hɔ.
Thank you. So in general, studies have shown that birth control in general, this is from population studies, does not affect your weight. So it doesn't make it go up and it doesn't go down. There is one form of birth control called Depo-Provera, which is an injection you get every 3 months that can sometimes increase your appetite, and therefore some people gain weight on that. But in general, birth control doesn't usually change your weight. And if you think about it, I like to explain it to my patients that birth control is most likely not gonna affect your weight, but you know what can affect your weight? Pregnancy. So I like to put that into context. But an alternative, if you're really concerned about hormones affecting your weight, is that there are different types of birth control available depending on your needs. There's the non-hormonal birth control, such as things like an IUD, like the Paragard. It's a copper-based IUD, has no hormones in it, and it goes inside your uterus to prevent pregnancy. There's another form of IUD that has hormones in it. It's called Mirena or Kyleena or Skyla. It also goes inside your uterus, and the hormones there act locally. So it's not something that affects your body per se. So if you're really concerned that you're somebody who gains weight on birth control, it's very unlikely that that's the main cause. But if you're really concerned, those are alternatives you can do. But in particular about like whether there are genetic predisposition to weight gain for birth control, I don't believe there's any studies that have explored that. But in general, if you look at your life and you know you're not eating right, you're not exercising, then I wouldn't blame the birth control for weight gain. We have to do a little bit of self-reflection and look at our lifestyles, because a lot of times we're not going to the gym as often as we should, we're not eating the food that we should, or we're not eating the portions that we should. And that is more a reflection on our weight than anything. And I know you didn't bring this up, but another thing I wanted to add is that anything that increases your abdominal fat, so the fat on your belly, that increases the estrogen in your body. And when you have increased estrogen in your body, that affects your period as well, but it also increases risk for certain types of cancers, uterine cancers as well. So us who have that, belly, we have to really work on that. We have to lose that belly fat, because that's something that affects our health more than anything. Not only does it affect our bleeding, it can affect your fertility. If you lose like 10 to 15 pounds, if you're overweight, that can increase your fertility just in of itself without medication. And it also decreases our risk for other complications like diabetes and high blood pressure. And so anything we can do to reduce the fat on our belly also helps with our hormones as well. Did I answer your question, Auntie? Okay, thank you.
Me paucho me deɛ no so related to birth control no. Me pese me hu say young people need be starting normal for menstrual pains na how long necessary mother sa birth control pills no so na sa pains no so beside that na unique obia, because I had that same problem. Sometimes some can say ebia wo wie kra pains no be jai, but throughout me years ni nyina my endure sa menstrual pains na nti beside that you need a fufuru biara wo me das.
It depends on what the primary cause for your pains is, but in general, you can be on birth control all the way until you're menopausal. And a lot of times, some people who have pains or the pains that you describe, whether it's because of endometriosis or adenomyosis or just plain old dysmenorrhea, which is period pains, the treatment is to suppress the hormones that cause you to have the pains itself. It shuts down your hormones, for lack of a better word. But you can be on that pretty much indefinitely. It's not gonna affect your health. So I know a lot of people are like, I've been on birth control for 2 or 3 years. Is this gonna affect my ability to get pregnant after I get off? And it's not. The birth control pills in particular are very much easy on, easy off medications. So it's so sensitive to the point that if you miss one pill, that's why you can get pregnant on it. So that's why it's very important that if you're taking it for pain reasons or bleeding reasons, that you stay consistent, as well as for contraception reasons as well. There are alternative medications to people who have period pains. The first line of medication is Tylenol, Motrin, just to treat the pain itself. And a lot of times people can get relief from that, or even like a hot pack or a warm pack from that. But then the next level is like different forms of birth control can be particularly more helpful in certain situations than others. And then ultimately, again, depending on the type of, or the reason why you have those pains, like especially for endometriosis patients or adenomyosis patients, the only real treatment is a hysterectomy. So if you're somebody who is planning not to have children in the future and that's where you are in life, then yes, ultimately you can consider a hysterectomy. But even still, there are still some people who might have pain afterwards, because it might not just be because of your uterus or your GYN organs. So it's something to reserve for last minute, but it is an option for people. But their medications are basically Tylenol, Motrin, birth control, some hormonal medications that essentially put you in like kind of a menopausal state, for lack of a better word, and then surgery.
What if someone has fibroids and every time they get their period, it causes them pain? Is there anything other than surgery or pain medication that could help with that?
So they found no Motrin for pain from that. In terms of surgery, there are other alternative procedures or surgeries that can be done, but it just depends on whether or not you're planning to have children in the future or not. So if you're somebody who's considering getting pregnant in the future, a procedure you can consider is called the transcervical radioablation. So basically they use microwaves to melt the fibroid. It's only done at a couple of centers. It's kind of like new technology, so you're not going to find it at most GYN places, but if you go to a specialist, that they might offer that. Otherwise, another common procedure is called a myomectomy. So that's the surgery where they remove the fibroids alone. Now, that kind of surgery is more complicated, and if you have questions about it, I can go into it in more detail, but that is something that can remove the fibroids. But just because you remove the fibroids doesn't mean you won't get fibroids again, because sometimes people can have fibroids that grow back. But that is something that if people have fertility issues, that they will do the myomectomy surgery so that they can get pregnant and carry a child. Now, another procedure you can do for fibroids that still keeps your uterus in your belly is called uterine artery embolization. And basically it's where they burn the blood vessels that feeds the fibroid. And so a lot of people find benefit from that, but you shouldn't do that procedure if you plan to have kids in the future, because you're killing your blood supply to your uterus as well. So that's why you shouldn't do it in that case. But otherwise, yeah, it's hard because there are medications that sometimes can shrink fibroids a little bit in anticipation for surgery, but in of itself, it's not going to make the fibroids go away. So unfortunately, there's not really medications to treat fibroids by themselves. Yeah, that's a very good question. Yes, there are some birth controls that do that, but it's really for people who are at high risk for developing blood clots in the first place. So certain people who are smokers, especially smokers over the age of 35, or if they have a family history, or if they themselves have had blood clots in the first place, we don't really recommend that they go on the birth control that has estrogen in it. So there's two types of hormonal birth control. There's a birth control that just has progesterone only, and then there's the birth control that has estrogen and progesterone in it. And there's also different ways of getting that birth control as well. And then there's non-hormonal birth control. So it just depends. If you're somebody who has certain risk factors, we don't recommend that kind of estrogen-containing birth control. Other risk factors do include hypertension. So if you're somebody with uncontrolled high blood pressure, it's probably not the best idea for you to be on estrogen birth controls, but there are some people who can still take it in a case-by-case basis, and we just, monitor them closely. But typically, for the average person, it doesn't cause them to have blood clots.
Like fibroids about PCOS, because I know like when I got into my 20s, a lot of like my friends started realizing they kind of have symptoms of it.
Mm-hmm.
I know the different treatments and stuff and birth control and the options, but I wanted to ask, is there something, different things you can watch before, I guess, I don't know if it's like in a prepubescent age or when it starts to happen, things you can do to, I guess, kind of make sure you don't have it, or if there's anything about you can do for that.
So I guess I should start. And basically, PCOS in of itself is not a disease, but it's kind of a collection of symptoms. So people are described to have PCOS, but their PCOS can be from many different things. Usually it's hormonal imbalances. So it can be from thyroid, it could be from prolactin, or it could be unexplained. But basically what describes PCOS is when you have a period irregularly, so like every 3 months or so, you start to have increased hairiness or increased signs of, we call it virilization, so like hair, what do you call it? Sorry, say that again? Parasitism, so increased hair everywhere, or signs of increased testosterone in your blood. And then your ovaries on ultrasound have a characteristic look, which is multiple cysts on it. And so you really only need to have 2 out of those 3 things to be considered PCOS. But again, PCOS in of itself is kind of like a broad category. But the things that are associated with PCOS include people having insulin resistance, or they're prone to getting diabetes, or metabolic syndrome is what they call it. They can have infertility issues as well because of it. And so there's nothing that in childhood would predict somebody that's gonna say they're gonna get PCOS or not. Really keeping track of your periods, so like I like to use an app or a calendar just to keep track of my periods, and if it starts to become irregular, you're like, maybe something is going on. But number 2, a thing that can sometimes treat PCOS people, weight loss. A lot of times people who have PCOS tend to be overweight as well. There are some patients who are normal weight and can have PCOS, so it's not always weight, but sometimes even just losing, like I said, the 10 to 15 pounds can make their periods regular in of itself, and then they're no longer PCOS. But another thing we do recommend is birth control to cycle their periods. And it's not just because you want to make their periods regular, because some people just like to have the regular periods, but it's also because people who have PCOS have increased estrogen in their body. And so when you have increased estrogen in your body, it can increase your risk slightly, but still increase risk for certain kinds of cancers as well. And so that's why we do recommend that, considering birth control for that reason as well. But just because you have PCOS doesn't mean you can't get pregnant, which is what a lot of people think, that I have PCOS, I can't get pregnant. No, you can still get pregnant. A lot of people with PCOS do get pregnant. And so if you're somebody who has PCOS and doesn't want to get pregnant, you should consider being on birth control for that reason. But if you're somebody who has PCOS and wants to get pregnant, sometimes there can be fertility issues in that situation. And there are medicines that can help, but the first thing I would say is, weight loss is really the main thing, especially in America. I hope that answered your question, but also answered a lot of other questions about PCOS. Okay. I don't know if we have more. Okay.
Now, my question is, so what fibroid maybe? The doctor catches us all would be. For example, maybe say, the second born. Me wagana no doctor kasa no fibroid. It is a me who obey operation. But they do some me no so man call no ano bi koji. Into the yanya operation be an the one. But me ba so ma benin sa o but ya ka fibroid asem dia. Ntim to me who say e wo wa na say e
You would need to get an ultrasound to see if it's still there. But there are some people who've had small fibroids before and it goes away. So it just depends on how big it was. One thing I will mention is that one question I get is pregnant patients who have fibroids and are gonna go for C-section, and they ask like, you're over there, why don't you just remove the fibroid at that time, right? Well, the reason we wouldn't do that at that time is because when you're pregnant, the uterus has a lot of blood. And so when we're doing C-sections by themselves are very bloody, and we want to minimize the amount of blood loss that they have. So the only reason we would do a surgery to remove the fibroids at the time of a C-section is that if it was one, to deliver the baby out because there's no other way to get to the baby, or two, if the fibroid was in a place that was compromising the closure of the uterus. So like if the fibroid was in a place where we couldn't close it without removing it. In those two cases would we do the fibroid surgery. But otherwise, you don't want to do that surgery unnecessarily during a C-section because it increases the blood losses, unnecessary risk. Rather, what we would say is that you have that surgery after you have your baby or before you plan to get pregnant. But if you're gonna do a fibroid surgery, particularly if it's a large fibroid or there's many fibroids, after you have your surgery, you should wait at least 3 months before trying to get pregnant. And then number two, depending on the amount of fibroids or where they remove the fibroids from, you're always gonna have to have a C-section afterwards because it wouldn't be safe for you to have a trial of vaginal delivery. So don't make that decision for removing the fibroids lightly because it does have implications for future family planning and such. But long story short, Auntie, you may have had a fibroid, it might have been small, it might have gone away, but the only way you can know now is to get an ultrasound.
The question is, no people said, do you do surgery? And so do you do surgery? And the second thing is, I get a lot of patients API, they have fibroid and also they have other issues, but surgery is probably the option. Now, what do you say? How would you advise a woman? Because you will be bringing surgery now say I am shishiaba. And is there something that you can say overall about surgery? Because I know you do surgery, but if you do surgery, what kind of surgeries do you do? Thank you.
But, so yes, I do surgery. But what I would say is that my attitude to surgery is it shouldn't be the first thing you go to. You should do surgery only when other options, especially medical options, have been explored and exhausted. Because surgery is always going to have its complications and its risk associated with it. So you shouldn't take it lightly. But in general, and especially in the hands of a high volume surgeon, they can decrease the risk associated with surgery. So I like to talk about, nowadays a lot of the older OBs that I work with complain that a lot of women don't want to have a baby naturally, vaginally. They want to just go for C-section because it's easier. The C-section is not easy. So I just want to tell women that, don't just go for a C-section just because it's considered easier, because the recovery from it is not easy. The risk associated with it is also, could be life or death. So we shouldn't do C-sections without considering all the risks, especially risk to the mom and risk to the baby. That being said, a C-section is a good surgery, but it's still major surgery. For fibroids, however, so fibroid surgery, I tell people it kind of depends on the age they're at for me. Because if you're somebody who's younger and you're looking to get pregnant because of the fibroid surgery, then you want to go for surgery where it's minimally invasive. That's what we call it. So that's the surgery where we put cameras in your belly. So with small holes in your belly, usually 4 or 5 small holes, as opposed to the big open surgery like a C-section surgery. The reason why is because recovery from that is a lot easier. And it's safer in the hands of a high volume surgery. But some fibroids are very big, so big in fact that it's not possible to do it minimally invasive, and they have to do it with that big open C-section like surgeries. And it's okay, there are things we can do to decrease the risk of blood loss in it, but it's still major surgery. And you also have to consider that if you're ever going for those type of fibroid surgery, that one of the risks is a hysterectomy, like losing your uterus. So, that's not the goal of the surgery, but it is a risk of the surgery. So you have to be aware of that. And other risks associated with surgery in general, like injury to other structures in your body, blood loss, infection, all those things are associated with it. So surgery in general should never be taken lightly, but it is still an option for certain people. And then if you're an older woman, you're done with, or you could be younger and you're done with having kids, then if you're really concerned about fibroids, at that time I would tell you just have a hysterectomy. Because a hysterectomy is actually safer and less bloodier than a myomectomy, which is that removal of the fibroid. So it really just depends on your goals in that situation. And then look at your surgical history. If you're somebody who's had 3, 4, 5, 6 C-sections and you've had other surgery on your belly and you have endometriosis, like, it's not the best idea to undergo surgery in that situation because you have a lot of scar tissue and adhesions, and that increases the risk for complications and, you know, other bad outcomes as well. You know, you can still go to a high volume surgeon, you could go to a specialist and they can do it, but even in the hands of the best surgeon, if your abdomen is hostile, that's what we call it, then it's probably not the best idea to undergo surgery unless you've done everything medically you could have, and that's your last option. So I've always been a believer that you want to do as doctors, we want to do the least harm to your patient. And it's true, there are some doctors who are quick to say surgery, surgery, surgery. But if you feel uncomfortable, if you're feeling like you're being pressured into surgery, you can always seek a second opinion, third opinion. This is America, you can go to anyone. And you yourself, you with your God, can discuss and figure out if this is right for you. Because I don't want to scare people from surgery, because surgery has its benefits, and there are certain cases where surgery is the only treatment that will save your life, you know, especially with like ectopic pregnancies and that stuff. But it shouldn't be taken lightly. So those of you who think like it's just surgery or things like cosmetic surgery, you have to understand that there's risk associated with it as well.
Amen and amen. Nyamisha will be brave. I wish I said I can one more time, but it's strange. I said they were here who be on show a name when I brave on finding DNA and mouse said you're the best. Amen. To some radio, you be jai. I'm a women ministry in paying for an announcement or honor what they are by Sunday about closing prayer. That was.
Nyame asese nyina ebe hye mpam cho announcement kakra wo ho yi